Welcome to the Dose of Good podcast, where we celebrate good people and organizations working to make the world a better place. It can be easy to get caught up in the bad things going on in the world and forget about the good happening all around us each and every day. I'm your host, Erin, and I want to share these stories with you and give them the attention they deserve. I hope this podcast educates and inspires you and maybe even motivates you to share a dose of good in your community. Now let's get into today's episode. Today we are going to be talking about the New Hampshire Mom Hub, and I'm very excited to be sharing this organization with you today. I really didn't know much about them before scheduling the interview and looking into them a little bit, and come to find out that's partly because they're a newer organization, but I think it's a very important one. Being a mom, well, I'll speak from experience, can be tough and can feel isolating and make you feel alone and like you don't have the support that you need. And that's where New Hampshire Mom Hub can be a resource for people if you're experiencing or you know someone experiencing struggles with postpartum or during pregnancy and might be looking for resources, whether that be peer support groups or just having someone to reach out to kind of navigate things and figure out where can I go for this resource. New Hampshire Mom Hub helps with that. So you will learn more about that in this episode. I speak to Program Director Allison Palmer, and she's got a lot of experience in this area and a lot of knowledge that she shares with us. And I appreciate her coming on the podcast to talk with me today. I do want to just give a little warning at the beginning here that this episode does contain mention of suicide, so please keep that in mind when listening. Today I'm speaking with Allison Palmer, Program Director for New Hampshire Mom Hub. Welcome and thank you for joining me.
Thank you, Erin. I'm so glad to be here.
So what is New Hampshire Mom Hub and what is their mission?
So New Hampshire Mom Hub is a very new program that is funded through the state of New Hampshire. That was a one-time funding through ARPA funds through the governor. And we are developed to be a centralized access point for moms and families and providers to navigate to resources and so that moms also have peer support for maternal mental health so that no mothers fall through the cracks.
That's great. An important thing that I personally think is definitely needed. So
yeah, it's definitely, it's for me, it came from some personal experience as well. And that's why we're doing what we're doing.
Yeah. Can you tell us a little about your background and how you became involved with New Hampshire Mom Hub?
Yeah. So I've been a nurse for almost 30 years. I grew up in volunteering at age 13. As soon as I could, I was in the hospital volunteering transport. Eventually wanted to check out maternity, labor and delivery. They let me go back and see deliveries and C-sections and do a lot more than they probably let volunteers do these days. But I loved the hospital. I love being a nurse. I think this was definitely what I was always meant to do. And I became a labor and delivery nurse, loved high-risk OB, the more complex like pathophysiology and complex diagnoses, like I'm your girl for that. I love the intensity and kind of thinking through the problem solving. And so I was kind of an adrenaline junkie in that sense. Worked at Brigham and Women's in high-risk L&D. And then went back for my nurse practitioner, became a women's health NP, loved working with moms, pregnant, throughout pregnancy, women across the lifespan, from adolescence up through older ages. And then I started having kids myself. I had my first pregnancy was pretty routine, and like I loved being pregnant. My first son was very type A, like for a type A person, I think he was very by the book. He ate every 3 hours, slept every 3 hours. And then, it wasn't always perfect, but I think I navigated it fairly well. When my second son came along, he did not sleep at all. He was difficult to console, like at night. And so, I think even during the pregnancy, I think with a toddler and having just the anticipation of having another baby. I had also had a miscarriage before my first son, and then before I got pregnant with my second son. So I think both of those experiences kind of like elevate that hypervigilance in general. And so this was kind of like building throughout my pregnancy. And then when I had my son, in those early weeks and months, I thought, okay, well, if he just starts sleeping, we're going to get through this. I'll feel better. And this went on for months. So I was becoming very like irritable, short-tempered, a lot of like more even like mom rage type of feelings that were unexpected. And you feel terrible and ashamed when you're having, those types of emotions because, what does a good mother look like, a mother? And so there were a lot of expectations and realities that were disconnected there. And I put a lot of pressure on myself to be 110% everything, mom, wife, nurse practitioner, wanting to do all of the things. And so I finally really things kind of like escalated or, where my husband and I both were like, okay, something has to give. This was about 6 months postpartum. So I ended up getting help at that point. Also really researching what was available in our community for postpartum supports. And there wasn't a lot. So at the hospital that I worked at, I ended up developing I started a postpartum support group. I developed screening in the inpatient setting, paired with follow-up phone calls, visiting nurse visits, and also created like a role for myself to do some navigation on the unit with moms that did score high risk. So we could talk about these things and get them connected to care. About 3 weeks after we had started that screening in 2009, there was a mom that ended up coming to our inpatient unit with she was 3 weeks postpartum, and she was having more of a postpartum crisis. And so met with her. She was was kind of disconnected, a little bit more lost, I guess you might say. And a week later, after when I was visiting my parents with my kids, I got an email finding out that she had taken her own life by suicide. And it was a gut punch. It was devastating because I was still pretty early in my own recovery in my postpartum journey. And at this point now, even though it had been like, a few years for myself, this was incredibly raw because I felt like I was really advocating and doing all the things that I wanted to implement to help prevent a tragedy like this. Mm-hmm. And then that happened. So the sister of the woman who passed away is Heather Martin, and she is actually my co-founder for the New Hampshire Mom Hub. So Heather and I have connected. We stayed loosely connected after her sister died. And in more recent years, Heather got really active in doing more advocacy for perinatal mental health. And last May, when we were with the governor, she said, we're not here just for the photo op. We need money too. And so he said, okay, well, put a proposal together. And so that's what I did. We put, some program, a model together and proposed it. And the governor, the executive council, for the governor's office approved ARPA funds this past November. And so this year we have just started launching the Mom Hub.
Well, that's one, it's great that you've started it. Two, thank you for sharing your story with us, because I think it's good that this is starting to get more talked about, because after having a child or while pregnant, it can be a very lonely, isolating time, no matter what you're going through. And then so many things can happen with the hormones, brain chemistry. And
Yeah.
I think any mom can use the support. And sometimes you don't always know where to turn to for that support, especially if you don't have close family nearby and that kind of thing. So it's great that you started that group at your past hospital, and now you're doing this so that there's more resources for women. And then again, the advocacy portion of it at the governor's office and everything like that. So what are some of the services that New Hampshire Mom Hub offers to people?
Yeah, so we've created a dedicated phone number that is 603-403-3400 that you can either call, text. We also have email, and we also have an online referral form. So if you just want to get on the computer, you can go on to hopeonhavenhill.org/momhub, and I'll give you all the links and everything for that. But we have an online referral form that anybody can refer themselves. If they're an agency, they can refer to us. So when we get a referral or a call or a text from a mom or a clinician, they can, if they're looking for peer support, sometimes you don't know what you need. And I think even for myself, I worked in the field. I helped mothers with these issues, and it's really hard to identify it when you're going through it yourself. Mm-hmm. So we provide that compassionate, warm understanding where we can connect people to resources. At the Mom Hub, we've done a lot of resource navigation and resource mapping with our New Hampshire perinatal quality collaboratives, and we have regional coalitions in each part of the state. Okay. I think that is a big part of what's making a lot of this work right now, is that we have more attention on maternal mental health, mm-hmm. and people are there's a lot of action happening right now around it. So we're trying to. The goal with the Mom Hub is really to connect patients to care so that they don't fall through the cracks. Okay. And that they also find a place where they have that warm, understanding, non-judgmental person that they can talk to.
Sure. So you said people can be referred or they can seek you out on their own. So mm-hmm. would anyone currently pregnant or postpartum qualify to apply at least?
Correct. Yes. Okay. Anybody who is pregnant that through at least the first year postpartum, the postpartum time frame, for if you read in the literature, a lot of people will extend that to 2 years postpartum. Mm-hmm. We know that that when postpartum depression and anxiety disorders go untreated, that it can last up to 3 years. It can really extend, and then sometimes go into subsequent pregnancies and become a more chronic condition. So people don't have. So it could be a grandmother. It could be even maybe it's a preschool teacher who has a parent that they're concerned about. Sure. They may, and even if they're just looking for additional education and training or how to support the population that they're working with, we can offer a lot of resources for that. And we do training. We'll do community events to meet with people and provide information.
I guess I wanted to kind of get your feelings on maternal mental health since you work in this field and have the knowledge and everything. Do you feel that it's often overlooked or underserved? And if so, what can be done about that, do you think?
So yes and yes. I think that it is overlooked. I think that there's a lot of stigma around mental health in general, right? And you're having a baby, so now there's this societal expectation that having a baby is this exciting time. Social media kind of amplifies gender reveals, and we have all this hoopla around, which is wonderful. We do want to celebrate this experience for people, but there can also be this like unspoken elevated expectation that it needs to be all, Pinterest perfect and, balloon arches and, celebratory color coordinated, events. And sometimes you don't feel that way. And
Right.
when you don't, it can feel incredibly isolating and kind of like punctuates that feeling of depression even further. I think in our healthcare system, that's really complicated. So after I was, doing programs with the hospital in terms of screening and the community, and then I went back for my psych NP. So I'm a dual certified women's health and psychiatric nurse practitioner, and I really wanted to focus on reproductive mental health. So I was doing that within a private practice, seeing OB patients, doing the whole gamut of GYN care, prenatal care, and then also seeing patients for mental health issues within our practice, which was wonderful. And during that time, previously, I had been really connected with Postpartum Support International. I was a state coordinator. I really had a lot of knowledge and connection. And I was at that age, too, where I was a young mom myself. Sure. So I knew, what was available in our communities. Then, as I got into, those busy years of raising my kids and I was in practice, within the office setting, over time, you start to realize, okay, I'm feeling more siloed, and so after COVID, it was in 2022, after my first son had graduated high school, I was really feeling like, oh gosh, I would be trying to see patients and also like put the resources in their after visit summaries and get them connected and trying to do all the pieces. And now I was at a different stage of parenting in my
Sure.
life too. And I was like, I really need to get back to this. I'm like, things are disjointed. And what I found is that moms are often like this hot potato in healthcare, especially in pregnancy or early postpartum, because we have the OB providers who may feel that mental health issues fall into the psychiatry jurisdiction. You have the psychiatrists who actually, may not have had any training in reproductive mental health. There's actually nothing mandated that they need to have that as part of their curriculum. So they might get, a small portion it's touched on, but it's not that significant. So they don't always feel well equipped to treat pregnant and postpartum patients if they're, because of the reproductive risks, perhaps with medication. And so they would be like, oh gosh, you're pregnant, you're breastfeeding, stop all meds, or, or go talk to your OB, who's like, again, I don't do psych. I don't know this.
Yeah.
And then we know that like 40% of moms that are identified with postpartum depression and mood disorders occur, in the postpartum timeframe, like after birth. And that identification often falls into the pediatrician's,
Right.
care period. So, and the pediatrician is saying, well, I'm the child's doctor.
Yeah.
I don't take care of mom. So where does mom go? And so she often gets like shifted around and that can, or go back to your primary care. And then, so things will fall, into these different places. And I also find that in the office practice, we don't have a lot of time. I mean, you have providers that have really short prenatal visits. We're consistently asking medical providers to do more with less time. There are insurance reimbursement issues, and so I think from a healthcare structure, that's where the Mom Hub is trying to meet that gap and address those issues. That yes, you may now be screening, but then at the end of once you screen, now what? This is the moral distress that I think occurs for a lot of providers. They don't want to screen if they don't have a good, robust, toolkit or list of resources and providers that they can then send their patients to. So we're trying to meet that gap.
Yeah, well, thank you for that education for one, because I didn't realize that. I mean, I kind of experienced that after having my son of, like my OBGYN would check in. I would have to fill out a thing for my pediatrician, but yeah, I didn't have to take that next step. And I can imagine for moms who need that next step, it's got to be, I mean, they've already got so much going on. And then to be told, no, you need to go here. Oh, actually, you need to go here. That's just one more thing they've got to think about and one more stress put on them. And they probably are like, well, forget it then, because, what am I doing? Where am I going? Kind of thing.
It's exhausting. And you speak, Erin, to the point of like the mental load of motherhood. We don't give that enough credit too, of, that like we're like the organizers. I mean, thinking about, when you first have a baby and you have to get to an appointment that is, 25 minutes away, there's often traffic. Your baby just ate at what time, and how long is it going to take for you to get there? We're going to be in the appointment. What do I need to have with me? So there's that stage. I mean, and we see that all across parenting. Right. You're juggling, homework, activities, timing. When are we eating dinner? And trying to juggle all that in. Now, so if a mom has all of these, additional children or other demands in her life, she often is going to put herself last. And so when it's not easy, when it is not, when also, and this is at no fault to the providers, because it's a challenge for our healthcare system. But when we don't have like the infrastructure to help mothers navigate to a resource, they are going to put themselves on the back burner. It's going to go by the wayside.
Mm-hmm. Yeah. And it's great that New Hampshire Mom Hub is there to fill that gap. Is there I know slowly, hopefully things are changing, but is there anything you think can be done either with changing the healthcare systems or legislatively to kind of give even more support to moms, but also hopefully not have them be bounced around or fall through the cracks or that kind of thing?
Yeah. So actually Heather and we work with New Futures in Concord, Moms Rising, Reproductive Equity Now. A lot of the different organizations have come together, and we currently are waiting for approval for Momnibus 2.0, which is bipartisan legislation that's supporting additional screening of moms for maternal mental health in the pediatric setting. Which again, that's we're hoping that like having the New Hampshire Mom Hub and the coalitions of the perinatal quality groups all working together, that we're going to help be able to connect people to care. And another part of that bill is looking at childcare, because if parents don't have good access to childcare, they can't work, they can't go to school, they can't make their lives better. And then also a perinatal psychiatry access line. So this was actually in my first iteration of the proposal, was a component of a perinatal psychiatry access program. Looks at so these programs are in different states throughout the nation. A lot of them are HRSA funded, and the clinical support part is looking at training, education, and consultation with a perinatal psychiatric professional. So say myself, who has more training in perinatal mental health. I have a an OB who's like, oh, I have a patient that is on such and such medication. I don't know if she should continue it. She's having a lot of issues, So if people aren't, because we don't have enough reproductive psychiatrists to serve everyone in the state, it's not going to happen. But again, to avoid that hot potato mentality, we want to empower and educate the clinicians that do meet our moms with at least the fundamentals. I expect that there is, not everybody signed up to work in psychiatry.
Right.
I did not expect to land in this area myself, and it's a wonderful meshing of women's mental health, women's health in general, but we can basically help a lot of the consultation line can support the frontline providers to give them some additional education and training, to have a phone number that they can call, or an online resource that they can call to get some additional support in treating their patient. And then if the patient is really needs a much higher level of care, we can help support getting, navigating that and building that infrastructure. So there's more of that clinical piece. And we do have postpartum support. International does have that set up nationally. So that is a resource right now that any provider can utilize. They have on their website, a clinician, kind of like a referral, and into a form that you can pose a question, and they can get back to you. So that's specifically for healthcare professionals. But PSI then has lots and lots of online support groups for a lot of very specialized needs, like high need babies, moms that have had a perinatal loss. They have over 50 online specialized support groups that usually meet twice a month. So that's another thing that I love, is just that nuanced, a mom, when we talk to her on the phone and you start to glean the little issues that are going on, the problem list starts to form, and you're like, okay, but I know this support group. I know this doula in this area of the state sees patients that are dealing with perinatal loss. And so having all of that knowledge and having these networks of community really help us to get people really tailored types of care to what they need.
Yeah, that's great. And thank you for not only doing this, but helping to kind of push things forward, because I think too, there's some people that can't afford some of the resources that are out there because they don't have insurance, or they just are, struggling to get by. So it's nice that there's options there for those people too. So.
Absolutely. And that's something that we take into consideration, when we're navigating moms and family members to resources. We look at okay, all right, so we need a provider perhaps that takes WellSense, Medicaid, or they need, they have transportation issues. So looking at those social determinants of health, and that's where that human connection is more important. And we, even in a short period of time via text or a phone call, we can get a better snapshot of what's going on with mom and really tailor some of the resources to her.
Yeah, that's great. Just in your experience working with moms, why do you think it's so difficult for moms to ask for help?
Oh, we hate asking for help.
I know.
I just want to do it myself.
Right?
Right? I don't need help. Oh gosh, this is always, and as, we're independent.
Yeah.
We may not have somebody to ask for help.
That's
I mean, that
true,
was a part for myself too. My family and I are we're remote from local family. We didn't have that family network or grandma that we could ask to just pop over. And I grew up with both of my grandmothers living close by, they were around. That was a great support network. And so I think it could be people's natural supports are not readily available. they may not be a safe option, even if they are geographically close. There's a lot of trauma that comes up that's not addressed and sometimes when I'm talking with moms, I start to see, you start to see that this relationship that, who do you have close by for help? And I always, I always use the caveat of like if those people are they and are they supportive in your life?
Yeah.
Are they a healthy support? Just because they live close by doesn't mean that they are, they may be using alcohol or drugs or may not, and that may not be a safe person to drive your child to their activities or to tap back and forth to childcare. So we need to kind of go through those things. One thing I do say, I do a little trick that I'll often talk with my moms about that don't want to ask for help. Sometimes if they do have, a resource or somebody they're like, yeah, so everyone wants to help. But again, when you feel really overwhelmed, even just organizing those things or being able to, that each time I have to call, my sister-in-law to say, can you come over next week and take the baby? I have an appointment. If you do have somebody in your life or, whatever that resource might be, that you can, set something up perhaps when you're in this really more acute stage too of a regular occurrence, every Tuesday, can you come over and, and maybe that's time that you have a regular appointment for yourself. Maybe it's work. Maybe it's going to, getting out for a walk, getting a shower, getting a nap, even just somebody to come in and offer and provide the practical support so that, because I think years ago we had, intergenerational families, living under one roof and within villages and communities. And we have less and less of that, I think now.
Yeah.
In our world.
I can see that too. And I think also with some moms having kids later in life, maybe the grandparents aren't around or that kind of thing. So finding those supports and it can be a struggle to ask for help because one, you don't want to feel like you're burdening people. Two, sometimes, at least I know the way my mind works, it's easier if I just do it myself than ask for help kind of thing. Yeah. But it is good to kind of change that thinking because as you were talking, I was even just thinking about, I think of it as, you get a babysitter if you need to go out. But sometimes you just need someone to come by and help and watch your child so you can do the laundry or take care of the cleaning or things that, are difficult to do when they're running around or doing whatever they're doing. Yeah. So do you have any volunteer opportunities or do you mainly just use staff?
So right now we primarily have staff. We are a program that is that's built under the nonprofit of Hope on Haven Hill in Rochester, New Hampshire. So I am connected with them as a psychiatric nurse practitioner on their integrated team, and they are a program that has residential and intensive outpatient treatment for pregnant and parenting people with substance use disorders. So in the high intensity residential setting, those moms, we have room in the house for up to 8 moms and children up to age 5. And they can, it's again another great space where it removes that barrier of moms getting substance use treatment during pregnancy and their postpartum timeframe. When they need housing, they don't want to be separated from their child.
Right, yeah.
So this helps to bridge a lot of those gaps. And so when all of this kind of came together pretty quickly with the funding, Hope on Haven Hill, as a nonprofit, we needed also, it seemed like the natural place for for them to be the fiscal agent and, the anchor organization for us to build this program out of. So there's a lot of overlap in our missions.
Yeah. that makes sense.
So just to answer your question about the volunteers, we're looking to really build more, I think, with the Mom Hub, like peer support opportunities. So I would encourage, if somebody has like lived experience where they are looking to give back, or they've had, a certain type of experience that has really resonated for them, and, say, I had a mom that had reached out saying like, hey, I'd love to be a resource for moms that have had hyperemesis gravidarum. So that is severe nausea and vomiting in pregnancy. And sometimes you need like IV fluids, like a PICC line. Like it's pretty intense. And there's a lot of emotional toll that goes along with that. So I think that's something that when I was talking about the online, those specialized support groups, we're looking at like how we can build these networks right here in New Hampshire of having these specialized, peer supports that we as a Mom Hub can also provide some training and structure around. But they have the good stuff. They have that lived experience that really meets people where they're at.
Okay. That's good to know. You were talking about your funding. Does that have to be approved every year? And kind of going along with that, do you do any kind of like fundraising or things like that?
So this is part of, I feel like right now we're building the plane as we're flying it, and it's so exciting. And we're working on our sustainability planning. We will be doing additional fundraisers, looking for additional grant opportunities. The funding that we received was one-time ARPA funds. So yes, if people are listening to this and they're like, wow, this is something that I would love to help support, they can donate through Hope on Haven Hill, because that is the 501c3 nonprofit organization right now that is that we are building out of at the moment. So this is it's just an amazing place. So they can people can donate on the Hope on Haven Hill website, and in the comment section, you can indicate for New Hampshire Mom Hub specifically, and that will be earmarked.
Okay, great. Is there anything that I may have missed that you'd like people to know about New Hampshire Mom Hub?
I think that the one thing that I always mention is that we are not, a crisis emergency phone line, like a hotline. We are considered a warm line. So we operate, on, business hours, Monday through Friday. If people are needing more 24/7, I need to pick up the phone or text someone in the middle of the night, there's a national maternal mental health hotline. It's 1-833-TLC Mama, and that number can also be connected to our state crisis 988 and New Hampshire rapid response services too. So if you are, actively having any thoughts of harm to yourself or others, or needing somebody, really for immediate crisis intervention, 988 or the National Maternal Mental Health Hotline. And people can call us as well. We will help connect people to supports. But I always want to make sure that people know that there are other quicker access crisis resources.
Thank you for sharing, because that's important for people to know.
Yeah.
Well, then if there's nothing else, I just have two final questions that I like to ask everybody that comes on the show. And the first would be which nonprofit we should feature next, or it can also be just an individual who's doing amazing things in their community.
Yeah, I would have to say, I think Hope on Haven Hill is such a great organization that I am so fortunate to work with. When I had left my practice, and I was feeling like, I want to do more to look at like building capacity around perinatal mental health. I am on the board for New Hampshire Maternal Mortality Review Committee. And when I was at that first meeting, I sat next to Carrie Norton, who's the executive director for Hope on Haven Hill, and we were chatting a little bit. And she sent me an email saying, "Oh, you should come out to Hope. I'd love to, give you a tour." So I figured I would do a few classes or trainings or something with them. And then when I was there, Jess Bacon, who's a midwife at Wentworth Douglas, she was also at the maternal mortality group, and they're like, "Well, we actually want to have you part of the integrated medical team here." So I work with a family nurse practitioner, Monica Lord, Jess Bacon, and myself to provide integrated care so moms don't have to leave, to get to different appointments and stuff. So Hope on Haven. So I just feel like it's a really special place where they have intensive outpatient. They're actually going to be expanding to also provide like partial hospitalization for substance use disorders. So lots of different levels of care, and they also address the gaps of housing for moms, and that is served throughout the whole state. So.
Yeah, I'd love to have them on because that's an area that I'm not that familiar with, but also it sounds like something that I'm glad it exists for people and that I have that resource, because I don't know if there's many other resources like that available. So that's great that those moms have that place to turn to and everything. So. Yeah. And then the last question is kind of just going along the lines with the idea of this podcast and spreading kindness. And I like to ask people what kindness means to you, and if you can share any examples of kindness that you've experienced or witnessed.
So I think I see kindness as really empathy, and also paired with like a side of curiosity. I think when we have the opportunity to just really appreciate somebody else's experience, whether we understand it or not, just being able to try to listen without judgment, and just saying, I'm here to walk beside you. I'm here for you in this space where you're at. I think, that was, in my own postpartum experience, I think holding everything internally for so long and not feeling that I could share those vulnerabilities with other people, because it didn't seem like other people were really sharing, back then, a lot of their own struggles. And so interestingly, I think I was reflecting on this with, more recently so I'm at a different stage of my life, and like this perimenopausal time frame. I see that we're getting a lot of more attention for women around perimenopause and these changes that are kind of like postpartum revisited again. Okay. And when you think about it, there are a lot of biological and hormonal changes going on. And life changes, I'm at a stage right now where I'm launching children. I have, my senior, my son, who I struggled with and kind of like brought so much awareness for myself and brought me into a path that I'm so grateful to be on, is right next door at the high school, graduating next week. Today's his last day of high school. And so that is a really cool experience. I was at a New Hampshire nurse practitioner conference a couple months ago, and hormonally just feeling really just overwhelmed trying to get the Mom Hub launched and all of the things, a lot of, caring for aging parents that don't live locally, launching kids, older kids, bigger, just different problems, different issues. And I had a nurse practitioner, PD nurse practitioner, Susan McCune, who had been on our task force previously when I had first started doing this work, almost 18 years ago. And I had seen her at the conference, and she was talking, we were just catching up, and she's retired now. So she's was really supporting me in terms of like, you're doing a lot of work. you're going to, take time for you. The next day, the luncheon was this. We're in this big ballroom, all having lunch. I'm at this big table with other nurse practitioners, and Susan is giving a talk about self-care for all nurse practitioners, and just the waterworks started. I mean, and hormone, and I was having hot flashes, and I had somebody giving me a fan. Somebody's giving me a piece of chocolate. I had many all the women around were all started sharing their own lived experiences of where they're at in these similar journeys, and I was like, wow, here, and I'm just crying, and I just felt like, as bad as I might have felt at that time and emotionally, I felt like I was wrapped in a lot of support, and there were a lot of and so I think, and that was just that that quiet understanding, somebody just handing me a tissue, handing me, and saying I've been there. This is going to get better. You're not alone. So just knowing that you're not alone in whatever you're experiencing, I think is probably one of the most wonderful acts of kindness that people can experience.
Yeah, I totally agree. And that's wonderful that those people did that, because I think especially, I'm learning being a newer mom. I think it can feel isolating as much as it's definitely being talked about more than it used to be. Sometimes you feel like you're alone and you're the only one going through what you're going through, even though there are many other people going through it. Mm-hmm. And I think being able to connect with those people and understand you're not alone. They experience the same challenges that you do. You don't have to do it alone is something that all moms should, experience. And so that's why I'm really glad we were able to highlight New Hampshire Mom Hub today, so people know that this resource is available to them. And thank you for all the great work you're doing for people. And I think it's a great thing. So.
Well, thank you so much for having me. It's exciting.
You're welcome. No problem. I hope that you enjoyed today's episode and learning more about New Hampshire Mom Hub. I thank you for listening and supporting the podcast. I also want to thank Allison for coming on as my guest and educating us about New Hampshire Mom Hub. I hope that you will check them out as a resource if that's something that you're needing or you know someone that could use them as a resource. I also would ask that you consider donating to them, as I'm sure they could use the financial support. As always, follow Dose of Good Podcast on Instagram and Facebook. Also check us out on YouTube. We have all of the podcast episodes available on YouTube. And leave a rating and review. Share the podcast so more people can have a dose of good in their day and learn about these organizations. Thanks so much, and I'll talk to you soon.